intuitive technology. You have to get used to it. You have to learn what not to do and what to do and what to be careful of, because it is a pretty strong instrument in your hands, and you have to be careful on the oxygen tube and normal tissues that you don't want it to hit, including your own fingers. And on the latex gloves, it tends to burn a little bit. But as far as learning the procedure, there's lots of videos. Most of the laser companies actually give you videos for doing the different types of surgeries and that type of thing. So you're able to watch and learn and then try it again and repeat it in your own hands. So thank you, Michelle. So basically, it's fairly straightforward once you get used to it and comfortable in your hand. It's like holding a pencil. So once you get started, it's fairly easy. As far as the strength or how high of a setting to use for a particular procedure, it depends on the laser itself. So we've had 2 different lasers in the hospital, and the older one was not as strong, and so we had to set it higher. So on skin incisions, we would use it at 12. This one, we actually use it at 10. And then you just adjust it for what you're comfortable with and what you're familiar with, so it's based on experience. Declaws, depending on how tough the tissue is, how old the cat is, you might set it at a 3 for a very young cat with very flexible tissue, cartilage basically in their toes, or you might set it at a 5 on a 2-year-old cat that you've now had to declaw as an adult. And then most like small mass removals that you're just going to ablate, like on the eyelid or on the skin, usually between 5 and 7. So it's based on experience, and if you feel like you're going through the tissue too fast, turn it down. If you feel like you're really fighting it, it's either your angle or the strength that needs to be adjusted. Okay, so I think laser compared to scalpel blade, there's several differences. Some are probably obvious, but because the laser cuts and cauterizes, then the bleeding is significantly less. Even with a skin incision from a spay or a neuter, you see significantly less bleeding, and that also helps with visualization. Now I can actually see what I'm doing instead of taking time to dab and still not getting hemostasis. So you can even take the laser and paint it if it's still a little bit bloody. Or sometimes when they're large bleeders, you have to still use your hemostat and tie it off. But for the most part, our skin incisions are much easier because you can see what you're doing because there's less bleeding. And so that's probably the biggest difference with that. If you're not at the right angle, it can be a little bit uncomfortable because you're used to holding a scalpel blade more horizontal, where you're holding the laser more vertical, because it has to be perpendicular to the skin to cut it. So if you go at an angle, you're actually not cutting as well. So the best cut is actually perpendicular to the skin. So that can be a little bit awkward to begin with, but overall, I think that's how mainly compares. And it's a little softer to the tissue. It does char on occasion, so if you hit bone or if you hit fat, you might see some char, but it's definitely gentler to the tissue. So yes, I would agree that the laser does help with improved recovery time, faster healing time, definitely less pain, I think, associated with that healing, depending on the procedure. And of course, especially with declaws, not having to use especially tourniquets because of the bleeding issue, because the tourniquets actually can cause a lot of complications. Putting pressure on those nerves can be an issue, and then bandages, because we know cats hate bandages and they don't often stay well. So one good flip of the paw and it's across the room and out of the cage. And so yes, I think it does help, and it's actually one of the things that I noticed when I first used the laser is I always dreaded using the blade, or especially the Rescos, to do a declaw, which is quite aggressive, and so and there's a lot of complications possible. So using the laser really
made the procedure much easier, and actually don't mind doing it if we have to do it on cats, because we don't like to have to do it, but we can. And it definitely seems to help with recovery time and pain control, swelling especially, and that type of response. So yes, I absolutely agree with that. So I do feel like the laser has given me more ability to do more of the advanced procedures I might not be comfortable with if I only had a scalpel blade and clamps. Some of the larger masses, mast cell tumors, especially if they're large, or some of the ones with a lot of blood supply, you can use the laser to get the smaller bleeders and use the clamps, so you don't have as many clamps. So you don't have as many clamps to have to deal with and tie off. So that saves time too, which is nice, but it also makes you not feel as overwhelmed when there's a bleeder happening. And then for sure, scrotal ablation, so removing that very vascular scrotal tissue in a large breed dog so they don't get a giant seroma, which is very uncomfortable, then you know, most people wouldn't even think about that without some sort of cautery. And so having the laser really enables us to do that. Tail amputations are nice as well. If you have to amputate the tail because of an injury, you can use the laser, and you see a lot less blood. You still have to tie off the vessels, but you can actually visualize them instead of just something squirting at you, or again having to use the tourniquet. So sometimes in that case we still have to use it to a degree, but we can use it for not as long, which really is nice. So yeah, I think it would definitely be something that other people should use, and is great to have. I mean, I think it's one of our favorite toys in the hospital, and would definitely recommend the technology to colleagues. And if you haven't tried it, you don't know what you're missing. So it's pretty fun, and it really makes your life easier. So.